Hey guys, my name is Isabella and welcome to my ASMR channel. So before we get into today's video, just want to remind everyone about a couple of things. First, I have a Patreon where for $3 a month you can get 5 extra ASMR videos each and every month. I also have an OnlyFans, so if that's something you might be interested in, you can find the link to that down below. Additionally, if you're looking for a custom video, check out my Wizio where I make all of my custom videos. Hey, so is my first patient in the room. Okay, traffic was so bad this morning. I don't know, one of the roads was closed, the main one that I usually take coming to the office, and then I had to take a back road that was so backed up. Okay, so who is this patient exactly? Okay, so just here for a wellness exam. Anything else I should know? Let's see. Is this the patient's chart? Okay. Okay. How long have they been waiting? Okay, I'll get in there. Thank you. How many patients do I have today? Okay, I think just cancel my lunch. I was supposed to meet one of the other doctors from the clinic down the street, but I'm not going to be able to do that. Yeah, now that I'm kind of off to a late start, and by the looks of it, I'm going to need every minute I can get to make sure I get to see everyone before end of day. Okay. Yeah. Just let him know what's going on. Ask if we can reschedule our lunch to Monday. I think he'll understand. He knows, it's a new office. I'm trying to get everything under control, managed, and just still working out the kinks and learning how to be, I guess, more efficient. Okay. Thank you for making that call. Hi there. You must be... Yes. And can you confirm your date of birth for me? Thank you. My name is Dr. Isabella. I will be performing your wellness exam today. This is just going to be a head-to-toe assessment, making sure that everything is looking good and that you are nice and healthy. Okay? So obviously I'm sure you're very familiar with a wellness exam, how that works. Personally, I like to really walk my patients through exactly what I'm doing every step of the way. So if you have any questions at all throughout the exam, do not hesitate to ask, okay? Are you comfortable? You're good? Great. Then why don't we just hop right into it. Happy Friday, by the way. Do you have any fun weekend plans? That sounds fun. It's supposed to be quite hot out, so some type of activity to stay cool is definitely recommended. Well, this has been quite a hectic week for me, so I might just go home, relax, and not move until Monday. Yep, this office is pretty new. I just opened it last year, and it has been a lot of work, but it's been so great, so rewarding. I love the office, just the way it came out. I'm so happy with it. I think although it is a doctor's office, it really does have a warm feel to it. Thank you. Well, I worked with an interior designer, and we came up with an appropriate style that was still a medical facility, but also little hidden things here and there that will subtly make a patient feel more at ease when they're in the office, I think so too. But enough about that. Let's get right into it. So, okay, do you have any concerns or complaints that you want to bring to my attention before we begin? No? Okay, sounds good. And do you know what month it is? Correct. It is July, soon to be August. And do you know where we are? Very good. Good job. I'm just going to make some notes right here. I always have my paper, but also like to write everything down. So, one sec, let me just bring this up here. And do you have any allergies I should know about? No allergies? Okay. And on a scale of 1 to 10, 10 being the worst pain, are you in any pain today? Okay, good. No pain is what we like to hear. Okay, now for your temperature. Just going to grab my thermometer right here. Open your tongue. I'm going to place it underneath your tongue. I know, old-fashioned. We're not doing the forehead thermometer today. Okay. 98.6. Perfect. And now I'm just going to assess your overall skin. Skin color is even. Don't see any obvious lumps or lesions anywhere. No lumps or lesions. Your facial features are symmetrical. Very nice facial features, by the way. Not very hard to look at. You have no signs of acute distress. Height and weight is appropriate with your body stature. You have a very nice body stature as well. Good hygiene. You're dressed appropriate for the weather. It's just my basic assessment. Okay. And if you don't mind, I'm just going to sanitize my hands, and then I'm going to put some gloves on, and we are going to get to the physical portion of the assessment. Okay, one moment. Okay, so here we go. I sanitized while I was up. Hands are clean and free of germs. Okay. And now I'm going to start by feeling around the top of your head just for any lumps, bumps, lesions, anything that looks out of the ordinary, okay? Everything feels good, very normal, nothing nothing that stands out to me as out of the ordinary. So next, I'm just going to assess your pupils. Pupils are round and normal. They're equal as well. Okay, just make a note of that. Okay, now I'm going to, where did my little light go? I'm going to flash this light in your eyes, okay? And I'm just going to use this to look at your eyes, but I want you to focus on my nose, okay? Just focus on my nose. Pupils are appropriately reacting to light. Beautiful eyes, by the way. The color is absolutely stunning. Seriously, beautiful. Okay, yes, so pupils reacted to light. Okay. Now I'm just going to hold this up. I'm going to bring it closer to your face, okay? I'm going to bring it up close to your eyes, so just okay. Yep, focus on it. Good, very good. Okay, the next thing we're going to do is just pull down your under eyes and take a look, see what's going on down below. Pull down. Good. Everything is very good, very healthy, normal. Nothing out of the ordinary. Okay. Okay, perfect. Just make a note of that. Do you have a hearing aid, by the way? No hearing aid, okay. Okay, so then just using this light, I'm just going to take a quick look inside your ears, okay? Quick look. See if there's any redness or drainage. Everything looks good. Nothing. I'm just gonna feel your ears for any bumps, tenderness. Check the back of your ears, and everything's good. Now let's look inside the other one. Okay, again, feel the ear. Okay, no tenderness, no bumps, lumps, no redness or drainage. Okay. Okay. Perfect. Just make a note of that. Normal findings. Okay. Now I want you to tilt your head up. Thank you. And I'm just going to take a look up your nose. Okay. Take a look. I see. Do you have allergies? Okay, yeah, I can tell nothing out of the ordinary now, though nothing to be concerned about. Yeah, so there's slight redness, but slight drainage, and no deviated septum. Can't speak today. Just one of those days. Okay, you can put your head back to normal. There you go. Okay, we'll just make a note of that. So, nothing concerning. And have you had any trauma to the nose or any past surgeries? No? Okay. Okay. Okay, so now I want you to plug one nostril, breathe in. Now do it to the other side. Okay. Okay, good. Thank you. Now I'm going to look inside your mouth. So just open your mouth wide and say, ah. Stick your tongue out. Ah. Ah. Okay, everything looks normal, healthy. Beautiful. Great. Great, great, great. Okay, now let's test your range of motion. So I want you to just look straight at me. Tilt your head up. Now down. Now to the right. To the left. Good. Range of motion is great. You have full range of motion with the cervical spine. No labored breathing or use of accessory muscles. Okay. Okay, now it's time for the fun part. I'm kidding. Well, I hope most of the exam has been fun for you. I try to make it as relaxed as I possibly can. And it's, it's easy when I have patients that are as great as you. Okay, so what I'm going to be doing is I'm going to be placing my stethoscope on 6 different areas, and every time I move it, I'm just going to need you to give me a deep breath in and out. Okay, so I'll help count. There's 1. Okay, 2. 3. 4. 5. 6. Okay, very good. Thank you. Just make a note of that. Okay, now I'm going to go around to your back, and I'm going to do the same exact thing, okay? So, 1, 2, 3, 4, 5, 6. Very good. Thank you. Okay, now I'm going to be listening to your heart. So for that, you can just breathe normal, okay? Okay. Good. Good. Thank you. No signs of heart murmur or anything. Okay, great. So now okay, so now that we did that, I'm just going to can I see your arms outstretched? Just going to feel. Okay, great. So no lumps, lesions, obvious scars, trauma to the area. Good, thank you. Let me see your fingers. Nails are short, round, and clean on both hands. Okay, so are you comfortable? Good, okay, I'm just gonna have you stay like that for a moment, and this is where we just get into the rest of the full body exam. So let me just make a note. Okay. Okay, great. So now that you are laying like that, I'm just going to lift your shirt up and listen to your stomach. So I'm just going to put in my stethoscope again. I'm just listening to the 4 quadrants. Okay, everything sounded normal, so now what I'm going to do is I'm just going to palpate different areas of your stomach. Your job is to let me know if you feel any pain or tenderness at any time. Okay? No? Okay, you're good? Great. Okay, perfect. And now, let's see. Now I'm just going to make my way down to your feet. I'm going to feel for a pulse. Good. Now the other foot. Okay. Now can you lift your knees up for me? Okay. Now I'm just checking for any edema. No edema present. Yes. Lower extremities look good. Great. Everything appears very normal to me. And now you can sit back up. You feel okay? Are you dizzy at all? I know sitting up quickly sometimes you can feel a little dizzy, but okay. So now I want you to raise your arms like this, and I'm going to push them out, push them in, towards you, towards me. Okay, now I'm going to go down to your legs, and I'm going to do the same thing, okay? So I'm going to try to push them apart, push towards me, push away, towards you. Okay, 5 out of 5 strength on upper and lower extremities. Okay, that wasn't so bad, right? I try to make my exams as enjoyable as humanly possible. Thank you. I appreciate that. Well, it sounds like you have fun weekend plans ahead of you. So now you have perfect health from your doctor, so you can go out there, conquer the world, do whatever you want. In moderation, of course. So, yes, you will need to get some blood work done. The lab is just down the hall. Once you're leaving, you will see it on your right. Small little room. And then those results will be uploaded to your patient portal probably Tuesday or Wednesday of next week. Could be a little later, but roughly Tuesday or Wednesday, I would say. And if everything comes back normal, you won't hear from me, unless you want to hear from me. And then you should be good to go. have any concerns or things you forgot to ask, let me give you my personal cell phone number. I'm going to give you my personal cell phone number and call me with any concerns at all, okay? Let's see. This is my number all hours of the day. You just text me, call me. Save it as Isabella, not even Dr. Isabella, because I don't want you to feel too formal with me. Love your background, by the way. It's a beautiful picture. Is that your dog? Very cute. Here's your phone back. Are there any last minute questions you can think of to ask me? Oh, no, I'm actually not married. Weird question though, not really related to your health. I noticed it appears that you are not married either. Yeah, guess we have something in common. Well, then I might as well just go out and say it. If you're ever looking for someone to grab coffee with, I would definitely be open to it. You have my number. Maybe a drink. I'm off all weekend. And by not married, I was also assuming that you would jump in and say if you were seeing someone. Okay, just wanted to clarify that. Well, then, looks like I will be seeing you again real soon under less formal circumstances. No, I don't make a habit of socializing with patients. Only the very special ones. Just don't let it get around. Go get that lab work done and then text me later and we'll make a more solid plan. I better get to the rest of my patients for the day, or there's no way I'm going to be able to meet you for that drink this weekend. It's hard meeting someone. You just gotta grab the opportunity when you can, right? I look forward to seeing you. Bye. Thank you all for watching. I'd like to end this video by giving a special shout out